25-year-old Buhle Dlamini has been living with HIV since 2022. She was a first-year student at university when she found out about her positive status.
Me and my friends were like, we saw this container and people were testing for HIV, and my friend was like, let's go test. And I went, I was like, I don't think it would be a big problem. Then we went there and I tested, and I found out that I was HIV positive. But because it was first year and I had a lot of freedom around, I was doing everything. I was outside of my parents' house. I was dating here and there. And then I think that is how I found HIV.
Buhle says she was gutted when thinking of the prospect of living with HIV all her life.
The first day when they told me, at least there was a lady that was a counselor who spoke to me at school. And then when I got to rest, I had to cry the whole night. I was so heartbroken because I've seen my uncle die because of HIV.
Buhle attests that it took a while for her to fully accept her status. But once she did, she said she quickly learned about the importance of taking her chronic medication and adhering to it. Buhle tells us that beyond taking medication, she took a keen interest in learning about the different organizations that advocate for HIV-positive people, as well as the government's efforts to combat the disease. That's how she became aware of the critical role that UNAIDS is playing in leading the global effort to end HIV and AIDS. She says she's now concerned that the move to shut down the agency may be detrimental to those living with the disease.
Immediately, what comes to my mind is the fact that we may not have treatment. It may take time if we do have it. Sometimes, what if we don't get it? Sometimes, what if we are not able to take our tests or receive the same support?
Buhle is one of millions of South Africans who will likely be affected by the United Nations move to close the UNAIDS agency. Many African countries are deeply reliant on UNAIDS and are worried the changes could be detrimental for their HIV response efforts. The United Nations has proposed shutting down UNAIDS by the end of 2026. Yudisa Njambela for CGTN in Johannesburg, South Africa.
CGTN's Enoch Sikoli has more on the impact of funding cuts in the fight against HIV/AIDS.
4 decades since the first cases were reported, HIV remains one of Africa's greatest public health challenges. According to UNAIDS and the World Health Organization, an estimated 1.3 million people contracted the virus worldwide in 2024, with nearly half of these new infections recorded in Africa. Yet, behind the numbers lies a story of resilience. Since 2010, AIDS-related deaths have fallen by 56% in sub-Saharan Africa, a triumph born of science, solidarity, and the determination of those infected and affected by the virus. Across the continent, governments have stepped up. From Kenya's free antiretroviral program and South Africa's nationwide testing campaigns to Nigeria's push for local medicine manufacturing. South Africa currently covers 77% of the funding for its AIDS response. Its 2025 budget outlines a 5.9% annual increase in health spending over the next 3 years, with 3.3% of that growth directed toward HIV and tuberculosis programs. By December 2024, 7 African nations, Botswana, Eswatini, Lesotho, Namibia, Rwanda, Zambia, and Zimbabwe had reached the so-called 95-95-95 targets. That is, 95% of people living with HIV know their status. 95% of those diagnosed are on treatment, and 95% of those receiving treatment have achieved viral suppression. It seems countries are stepping up with domestic funding, and communities are showing what works. UNAIDS says these achievements must be preserved and expanded further. But the fight isn't over, especially for women and young girls. 63% of all new infections in 2024 were among women and girls in sub-Saharan Africa. In schools, clinics, and homes, they carry both the weight of prevention and the burden of care. But the battle against HIV has continued to stretch Africa's health systems. Healthcare workers face burnout. The economic toll is staggering. Families lose breadwinners, economies lose productivity, and governments shoulder enormous costs for lifelong treatment. And now, a new crisis threatens to undo it all. The 2025 UNAIDS report warns of a funding collapse triggered by sudden international cuts. Community programs are closing, outreach workers laid off, and treatment interrupted. UNAIDS says if the cuts persist, the world could see 4 million additional AIDS-related deaths and 6 million new infections by 2030. It emphasizes the danger of the virus finding its way back into communities they fought so hard to protect. Yet, there is hope. New long-acting pre-exposure prophylaxis like lenacapavir offer what scientists call a prevention revolution. A single injection lasting months could change everything. South Africa was the first country in Africa to roll out lenacapavir, a twice-yearly injection that significantly reduces HIV infection risk, marking a potential turning point in the nation's battle against HIV/AIDS. Enoxi Collier, CGTN.
Let's take a deeper look into this, and we have with us Professor Mirgisa Kaba, Professor of Public Health at the Addis Ababa University. Thank you very much, Professor Kaba, for joining us. Now, many African countries have termed the move to sunset UNAIDS as profoundly dangerous for their HIV response efforts. What is the immediate danger of UNAIDS shutting down? And besides funding, what other crucial functions does the agency play?
Well, thank you so much for having me. This is a very important topic. Yes, certainly such an abrupt action would have an important implication in terms of, the life lost in consequence, especially under circumstances where African countries generally are not prepared for such an abrupt kind of action. So yes, there are going to be really serious repercussions in connection to this one, under circumstances where people who are living with HIV are going to really, suffer the consequence of lack of treatment, and more importantly, in terms of also the care and support that they have been getting out of support that was being pledged by UNAIDS. So yes, obviously there will be serious consequences out of such an action as we see now.
Now, critics often point to the high reliance of African HIV programs on external bodies like UNAIDS. Question is, why is it decades into the epidemic, many African governments have not successfully transitioned to fully domestic financing and management of their HIV response?
Well, I think, in my view, there are certainly, countries that may have already thought about it and perhaps started some level of, allocation of resources. But in as far as my knowledge goes, the level of attention that has been given by African governments in order to really take up and make sure, those people who have been on antiretroviral drug, for instance, can get those services under circumstances where there is absence of support, aid from the northern countries like the states through obviously UNAIDS and other agencies that were operating under USAID. In my view, there isn't really as much preparedness by African countries, and consequently, the damage would be serious. That's what I important to understand. Those agents, the organization, including UNAIDS, do not see seem to have built the capacity, the institutionalized capacities of African countries to be able to take over, over time. So that's also part of the problem that I see. So I don't see. In as much as domestic financing is critical and very important, I don't think there is as much preparedness by African countries to take over and run their own business as far as HIV care treatment is concerned, as well.
I'm afraid we've lost his signal, but I think we've gotten largely his insights on this topic. Professor Mirgisa Kaba speaking to us there from Addis Ababa.